Heel pain is a very common condition. It's even more common in women who are expecting. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. The problem is that while you're pregnant, you can't take most medications that are used to treat heel pain. In today's video, I'm going to discuss how you can manage and even cure your heel pain even while you're pregnant. Before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. I also wrote a book all about women's foot health. I'm happy to send it to you for free. You can request a copy at www.foothealthforwomen.com. Women have different experiences when they're expecting. Some love the feeling of being pregnant. Others are brutally aware of every ache or pain that comes with every pound of baby weight. A common complaint of many pregnant women is tired, swollen, and achy feet. As the baby grows, mom's center of gravity moves forward. This puts strain on the feet and ankles and significantly alters the natural mechanics. This can lead to muscles and tendons getting more use than usual, which can cause them to become more inflamed and painful. This inflammation can cause two very common presentations of heel pain. One is plantar fasciitis, which is pain in the bottom of the heel and in the arch. The other is Achilles tendinitis, which causes pain in the back of the heel. Both of these causes of heel pain have the same thing in common. One is an inflammation of the plantar fascia ligament as it attaches to the heel. The other is an inflammation of the Achilles tendon as it attaches to the heel. Ordinarily, both of these conditions are responsive to oral anti-inflammatory medication, which can control the pain. In some cases, a cortisone injection can be helpful as well. The problem is that when you're expecting, you absolutely cannot take any anti-inflammatory medication. You might be able to have a cortisone injection, however, it's not ideal. When you ask many doctors what can be done to cure heel pain during pregnancy, it seems that the popular answer is, have the baby, then call me. It's not a helpful answer. Why should any woman have to suffer for weeks or months with heel pain? I don't think they should. So I've developed a protocol to resolve your heel pain during pregnancy, and we can do it all without medication and steroids. By the way, you don't have to be pregnant to take advantage of this protocol. Pregnant women cannot take anti-inflammatory medication. You may prefer not to take the medication, and that's absolutely fine, and this protocol is for you too. To address these causes of heel pain, we have to address two things: the inflammation that's causing the pain and the mechanics of your foot that's preventing the pain to go away on its own. Addressing inflammation when you can't take anti-inflammatory medication is a challenge. In my practice, we can address it in two ways. The first way is right for everyone. It's an in-office, non-invasive, non-painful treatment called shockwave therapy. This treatment sends thousands of mechanical shockwaves into the site of injury. It causes an increase in blood flow to that area. This allows your body to send growth factors, proteins, and healing factors to the injured area and allows your body to heal itself. Shockwave therapy consists of 3 treatments, each about a week apart, with each treatment being about 10 minutes. After the first treatment, you'll experience a reduction in pain. The treatment course is cumulative, so the next treatment builds on the one before it. Shockwave therapy is completely safe if you're expecting, and we use it to treat people who are not pregnant too. In cases where you have a severe case of heel pain, I may recommend an injection of Platelet Rich Plasma, or PRP, in addition to shockwave therapy. In these cases, we'll usually use the PRP injection at your second shockwave treatment. Platelet Rich Plasma, or PRP, is a well-established form of regenerative medicine using your own blood to cure your foot or ankle injury. Plasma is the clear fluid that makes up your blood and carries the components of blood, such as blood cells, platelets, and proteins. Platelet Rich Plasma is made from concentrated plasma. It has higher levels of platelets and proteins that helps your body create more cells to heal these injuries. The PRP procedure is done entirely in the office. First, your blood is drawn. After that, it's placed in a centrifuge where it's spun at high speeds to separate the blood into different layers. The result is a high concentration PRP sample that's ready to be injected into the injured area to provide exceptional results. Because the PRP injection is derived entirely from your blood, there is nearly no chance of side effects after the injection. In fact, platelet-rich plasma is a very low-risk procedure overall. The results of a PRP injection are usually dramatic and exceeds the expectation of our patients. It's important to mobilize and stretch the soft tissue attaching to the heel to help the tissues recover. For this, I recommend the Alleviate Arch Massager. The Alleviate Arch Massager works on the principle of the Graston technique. The Graston technique is a form of manual therapy known as soft tissue instrument-assisted mobilization. It works to break down the scar tissue and fascia restrictions that are usually associated with injury to the soft tissue. It also reduces restrictions by stretching connective tissue in an attempt to rearrange the structure of the soft tissue being treated. Overall, it promotes a better healing environment for the soft tissue. The Alleviate Arch Massager is designed to give you the benefits of the Graston technique to be able to use at home. It delivers a professional-grade massage that boosts circulation and breaks up the scar tissue, aligns your muscles and tendons, and relaxes your arch into a normal posture, and that relieves the pain. The patented dual peak design allows you to reach any part of your foot with the proper amount of pressure. When you use the massager, you will feel it. That's the main difference between rolling on a ball and using this precision arch massager. You should feel it. It means it's working. Expect to feel some discomfort, but not pain. Don't overdo it. I recommend you use the arch massager twice a day for only 2 to 3 minutes each session. Finally, we have to give the foot support to limit the pull of the soft tissue on the heel. Insoles can be helpful for this, but taking it to the next level, I recommend the Alleviate Loft Brace. The Loft Brace lifts the arch to reduce the pull of the plantar fascia on the heel. It's adjustable and wearable during any activity that causes you pain. It's also low profile, so it's able to fit in most shoes. There are 3 components that make the Loft Brace so effective. The dial lacing system customizes the amount of support that your foot gets. The laces act as a suspension bridge, which lifts the arch to reduce the stress on the bottom of your foot. The arch plate is anatomically designed to adapt to the structure of your foot. Finally, the heel pad offers extra cushion for the part of your foot that can hurt the most. The brace literally hugs your heel for additional comfort. Both the arch massager and the Loft Brace come with a 12-week access to the arch exercise program. This is an innovative research-backed stretching and exercise program designed for plantar fasciitis. It strengthens and stabilizes your leg muscles for long-term pain prevention. The program includes easy-to-follow instructional videos, built-in progress tracking, and expert coaching for your recovery journey. It lets you exercise when and where your schedule allows. The routine takes less than 15 minutes to complete, and it's recommended that you use it at least 4 times a week. There you have it, an effective protocol to manage heel pain while you're pregnant, all without any medication. You may find it surprising, but people choose this protocol even if they're not expecting. They just like the more natural approach. The best thing is, it works. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. I also wrote a book all about women's foot health. You can get it for free at www.foothealthforwomen.com. The link is in the description. If you're currently expecting and you're suffering with heel pain, you do not have to wait for the baby to be born to find relief. Give us a call at the office and we'll get you in for an immediate appointment. The link is in the description. Thanks so much for watching, and have a great day.